Welcome to The Whole Pineapple. I'm Ruby Boris.
And I'm Ann Judge. The Whole Pineapple is a podcast about wellness focused around fertility. And on these weekly mini episodes, we bring you bite-sized ideas for you to snack on.
Like breathing exercises, book reviews. Maybe we'll review some scientific research, or we'll share some wellness and fertility stories from our listeners.
So if you're looking for a tip or a trick related to your fertility and well-being, then you've come to the right place.
Let's dig in.
All right, welcome back to the Whole Pineapple Snack Edition. In kind of our continuing series on education and breaking down questions that people have about common things in fertility treatment, we thought we would talk about some of the really common questions we get for the things that people should avoid during IVF. I know a lot of people have concerns. There's so much misinformation online. And so we thought we'd kind of get into what are the big, not so much do's and don'ts, but just like don'ts.
Mostly don'ts.
Don'ts that, and sort of why are they don'ts? How confident are we in that recommendation? And just sort of a little bit of the myth busting as well. So
how much of it is just because we've always done it that way?
Yes. And it's funny. I was thinking when we were talking about this, did I tell you my story about our incident in Miami being turned away from the restaurant?
Yes, you did tell me the story, I think.
But I don't think I told it on the podcast before. So I was thinking of it for here because we, a couple years ago, went to Miami for the first time and we're excited. And we had made reservations in advance a long time online. And we're like, oh, has really great reviews. Let's go there. And then when we showed up at the door, we were, Northwest nice. My husband had a button-down shirt and jeans and not tennis shoes, kind of nice casual shoes. I had sweater, leggings, but we weren't Miami nice apparently. And the guy at the door just kind of looked at us and was like, we have a dress code. And we looked online, their dress code online just said no flip-flops, no tank tops, no beachwear. And he's like, well, we are going for elegant chic and this is not.
He did the hand wave.
He did the hand wave. And the restaurant was at the top of a staircase. So he's literally above us with his fancy thing, basically just looking us over. And we realized we are not Miami chic. But what made me so mad was well, then tell me, put on the dress code, dress to impress, must have heels. If there are things you want us to do, just say it and we'll do it.
That's so hard for a rule follower too. You're no, I am following the rules.
Shall I pull up your dress code? And so I feel that's what it's like for people in IVF too. They're if there's something you want me to do, just lay it out, tell me what to do and I will do it. But it's this confusion of people feeling there's some mystery set of rules they don't know about that can be so overwhelming.
Or are these rules, or are they just guidelines?
Right.
Kind of thing.
How important is if I'm having to prioritize the changes that I might make for my life, what should I really focus on versus what is maybe more myth?
Yes. And how much of this is pirate code?
Perfect. Well, what do you want to start with?
I think we should start with exercise because I think that is the number one question I get from people about during their IVF cycle. Mostly beforehand, because I get a lot of people, myself included, I would be the exact same way. And whenever I've had any kind of procedure that decreases my amount of time to exercise, that is one of my first questions. So why we tell people to decrease your activity during IVF. And I would say a lot of my patients ask me so when exactly can I stop running? Or when exactly can I stop working out? And do you want to tell us what we recommend? And then we can talk about why.
So again, it's guidance. With every cycle, what IVF is a stimulation of the ovaries, right? We're trying to grow multiple eggs. We're going to enlarge the ovaries. And so when the ovaries are bigger, we're talking about ovaries that are often an order of magnitude increased. Usually I like to talk with people about the fact that baseline your ovaries are almond sized and we're going to make them mandarin orange sized. And sometimes people even get baseball or softball sized. Yeah. And so those visuals are really helpful to think about like these little tiny organs that you don't usually think about are going to be in there and they're going to be big. And the last thing we want to do is have any injury to the ovary. So that's the big thing. I think people get confused and they think that this guidance against exercise and IVF is because it's going to make you less likely to get pregnant. And it is not that. The reason that we talk about it is we want to protect those ovaries when they are enlarged from twisting or bending or having a cyst rupture and anything that could be damaging for the ovary. But it's not because it's changing the chance of getting pregnant in the cycle. And that's the reason that the guidance is different when someone's doing IVF versus if they're just taking oral medications and trying to release 2 eggs instead of 1 egg.
Yeah, or even an embryo transfer cycle is a little bit different leading up to your embryo transfer anyway.
Exactly. And in terms of the timing, so, we are a little more conservative. Like I usually tell people from when you start the injections until basically until we think your ovaries are back to baseline. So if you're just freezing eggs or freezing embryos, often you're going to be getting a period, and that's usually going to be a week or 2 after. And that's a good sign that your body is sort of resetting to baseline. And that's when you're okay to resume normal activity. Now, if you're doing a kind of old school cycle where you're getting pregnant, that also means we've used a different combination of medications because we're trying to support pregnancy. And so often your ovaries do take longer to kind of shrink back down. And so in that case, often we'll have people be taking it easy even longer. It's a pretty individualized discussion at that point.
It really is. And some of it is kind of intuitive too, because honestly, when you get to day 7, 8, 9, 10, 11, you are probably not going to want to do anything too jarring to your pelvis anyway. So what Anne was referring to is something called torsion, where the ovaries kind of twist over, and that can cut off oxygen and blood flow to the ovary. And so you can actually damage an ovary or even lose your ovary that way. It's very uncommon.
Lose your ovary because it will die with blood. It's not going to like fall off and disappear into your body somewhere else.
They just hang out on these little ligaments. And so when they get bigger and heavier, they're more prone to twisting over. And we want to avoid that from happening by avoiding anything that is high impact. I can think of one person that has had torsion this time that I've been here, but that's because most of it is prevention.
Yeah, I can think of one too. And and again, we both worked here a long time.
Yeah.
But that is the reason too that it's probably most important, kind of day 5 on or so. But just to be careful, I feel like from the time you started injections, we know we're making those ovaries bigger. But also we are talking about high impact. So that's the other thing. I think some people feel like, well, for my mental health, I can't lay around and do nothing for 10 days. That's just not my normal routine. And so you can still do a lot of things. You can still walk, you can still do a gentle stationary bike, you could do more of a smooth gliding elliptical. It's really thinking about avoiding bouncing and pressure on the ovaries. So that's why running is a no contact sports, no skiing. That's always a big one we head into winter season here.
You can fall and hurt your ovaries.
You can fall, exactly. Yeah. And that's why a road bike is not okay, but a stationary gentle. I don't care if you're going on just a gentle neighborhood bike ride. If you hit a patch of gravel and you fall over and hit yourself on the side of the bike, that's not good for your enlarged ovary. So
yoga is one that I get a question about too. So fertility yoga is different than if you're going to hot yoga and you're doing inversions and twists and more of I can't remember the name of the specific yoga, but flow yoga where you're twisting and things like that. You want to avoid anything that's jarring, twisting, or inversions. Where you're going upside down, basically, down,
go back
down
and
dog.
Listen to our Lynn Jensen yoga about how different fertility yoga is. It's very gentle and kind of giving your body back all those energies. It's not making you be drenched in sweat and holding poses that are really uncomfortable.
Yeah, absolutely. And I just want to make sure that I do emphasize that I'm not saying no yoga. I'm saying nothing that is going to be jarring or twist those ovaries over. And so yoga fertility is great. So I think it was episode 2. So go back.
Yeah.
I think that covers it for exercise. Is there anything else?
No, just understanding that that's the reason. Because I think a lot of people conflate it being, reducing the chance of pregnancy. And so again, there's a lot of good research about why exercise is really good in pregnancy and good for pregnancy. So, with everything, there's a balance. People that are really strenuous, your marathon training, that can sometimes cause issues with ovulation status. So there can be times that over-exercise might be a negative. But in general, for most people, exercise is a positive. And the only reason we have that restriction is to protect those ovaries during that narrow window of time when they're doing a lot of hard work for us.
Yeah, and let's say you went through your IVF cycle, your ovaries are recovered, and you've done an embryo transfer later on, and now you're pregnant. You can continue doing most of the things that you did prior to pregnancy. So anything that's like Anne had mentioned, contact sports, definitely want to avoid. Same thing, anything that's going to put you at higher risk of injuring your abdomen. But I think that covers it for exercise. What is your second most common question that you get, Anne?
I'd say the alcohol.
So can I have a glass of wine?
Yeah. And especially, I think some of that we've talked so many times in these episodes about the social pressures. And for a lot of people, if you're usually someone that partakes in alcohol and then you're out somewhere and everyone else is having a drink and you don't have a drink, people instantly assume, oh, are you pregnant?
Yeah.
And it's just so a lot of people, even if they don't particularly care about having the alcohol, they don't want other people to notice they're not drinking and it turn into this whole conversation about things that you don't want to be talking about. So I get a lot of questions from people wanting to know. Or again, infertility is often a longer road than people imagine. And so it's one thing if you decide, oh, I'm going to completely give it up. And then, life goes on and time goes on and people start to wonder, well, wait, do I really need to be completely giving up on alcohol? Like what is an amount that I feel like I could partake in? And this is interesting. Like one of the presentations I did last year was on lifestyle behaviors. And, there have been large surveys looking at this. And the largest one was by Dr. Ali Domar. They did a large prospective study in 2015 of over 12,000 women at different clinics across the U.S. And they found that about 17 to 23% did drink during their IVF cycle. And this was a little surprising to them because their guidance says to avoid it. And so they were kind of looking at, it came out of an earlier study that they had done where it was just at their specific clinic. And the same thing, they find like we give these guidelines, but when you ask people, what are they doing? A lot of people still aren't completely following those. Why don't you say what we usually say about alcohol consumption?
Well, I usually say after ovulation. So if it's not in a non-ART cycle, I say after ovulation, pretend like you're pregnant, like, get that mindset in until you have your outcome. And then with IVF, I tell people that it is okay for a glass of wine here or there through your cycle, especially if it's going to just like help a little bit. But then again, after an embryo transfer is when you're going to want to avoid that. And the day before egg retrieval is probably not a good idea either.
Yeah, I'm pretty similar. And the other thing is realizing, again, kind of where these guidelines come from and how important they are. This is something that's been studied a lot, pretty much since the beginning of fertility treatments. And the problem is you're always going to have like conflicting data. There basically been like
Absolutely.
6 big studies that looked at alcohol use. And the problem is all of these, it's going to depend on where you set that threshold, right? Are you talking about use in the year before versus use in the actual cycle? What do you consider high consumption? Some places say high is 4 or more drinks a week. Some say it's 7 drinks a week. And so it's hard to set that threshold. And, because it's hard to set a threshold, the guidelines that they say is often, well, let's err on the side of caution. Let's have people abstain from alcohol. And I feel like that is kind of what we say too when someone's potentially pregnant. But if you're talking about just that consumption leading up, there have been studies that are, for the most part, reassuring. And there's a large cohort study that looked at 1,700 women, and they looked at different cycle types, so IUI, IVF, frozen embryo transfers. And what they really found is that the bulk of all that input was in the high consumption, which they defined as 7 drinks or more a week. So the people that were having 1 or 2 drinks a week, or even the 3 to 7, really didn't have much of a difference in IUI or in IVF. And so again, it's like so many other things. It's like, if you tell me what to do, I'll do it. But it's also like, yeah, if you're going to have a drink in that week before stim, is there really a lot of evidence that that's going to make a difference? There isn't. And so if you're thinking about where you want to improve lifestyle, we really should be focusing on people that are on that higher end of the scale, because that's something where we do have a lot of data that it could make a difference.
Yeah, absolutely. And that actually does mirror for just general health and other medical conditions. It's the same kind of thing that we're looking at numbers, and that 1 drink for women, 7 a week, is kind of where that threshold for the most evidence has been for negative outcomes. So I think caffeine is probably the other one.
Oh, that's what I was going to say next. Yep, I was going to say caffeine.
Yeah. Number 3 is caffeine.
Yep.
And so I get questions about caffeine every step of the way. I have a lot of people that come to us who haven't had a little drop of caffeine for a year and a half.
Not a green tea, nothing.
Nothing. And I'm like, Wow. And then, of course, they have questions like while you're trying, during your cycle, and while you await your cycle and in pregnancy. So every step of the way. And this is similar, I would say, to alcohol.
It is, yeah. It's actually quite similar because it's got 5 big epidemiologic studies and there's some conflict. And the thing that I find in it is that really when you're pooling studies together, this big original study that was done in 2002 is what found an impact that caffeine had a negative association with the pregnancy rates in ART. But this is back in 2002. And so 36% of the women in this study were doing GIFT, which is a fertility treatment where you're actually putting the embryo in the tube. It's basically one of the things that like it doesn't have the same success rates. It's really not done in the US much anymore. Now it's like less than 1% of IVF cycles are doing GIFT. And so all these more recent studies don't show that same negative outcome. And so if you're pooling stuff, you're really giving a lot of weight to an older study that's probably not that applicable to what we see now. And most of the other studies just talk more about, and again, just like with the alcohol, like there is a difference between someone that has a glass of coffee and someone that drinks 7 Diet Cokes a day in terms of like how much caffeine are you really getting on a daily basis?
Well, and quality too, right? Yeah, like you said, that's a really good example is like if you have, black coffee or a green tea, which I'll mention a little bit about green tea here in a second, but compared to like Diet Coke where it has all those other things in it, too. So there is a quality over quantity thing, but also there is a threshold for the quantity as well. And for pregnancy, Anne, what is the dose?
Yeah, it's the same thing. We usually just kind of say to keep it less than 200 milligrams a day. And so for most people, that really is what most people do consume if they have caffeine. I mean, just even for me, like tonight we have a holiday party for our office and I'm like, ooh, I might have an afternoon coffee, which is like a big
I might
wild.
have to.
Yeah, because I know it will keep me up later. And so just even for my own health, I'm always amazed by those people that can like have a glass of regular coffee after dinner. I'm like, how can you do that and still go to sleep a few hours later? So everyone's different. And if you have been having a really high caffeine consumption, then it would be good to work on tapering that back because that is something that we're not going to want people to continue in pregnancy. And that can be really jarring if you're usually highly caffeinated and then you just quit completely to start IVF. You're going to
get a lot of symptoms.
Yeah. So if it's something that you think you could benefit from cutting back, this is a great thing to do. But if you're someone that's already in that moderate consumption, then you don't have to feel guilty about that. The data that we have is overall quite reassuring.
It really is. And that's exactly what I tell some of my new patients too when they ask me about caffeine. It's like, well, if you have, let's talk about how much your intake now. And then let's talk about pregnancy because I want to get you, if you're really high, I have people that are like, yeah, well, I have like 3 energy drinks a day or something like that. We're going to want to cut that back because if you go from 3 energy drinks a day to nothing or like maybe 1 cup of coffee in the morning, you're going to get a lot of caffeine headaches and we want to avoid that. So a slow taper off before you get to pregnancy is probably for the best. Now, is it ultimately harmful to your body to have caffeine withdrawal? No, but it's not going to feel very good.
It's not going to feel good. And especially headaches are often something people do feel early on in IVF because you're having these sort of hormone changes. If you're sensitive to fluctuations in estrogen, it is a fairly common side effect. And so that can be really hard to sort out. Oh, wait, and you can't really take a lot of the good medications in the middle of an IVF cycle either. Like if you're someone that's prone to migraines, we don't want people using those prescription category drugs that are usually the best for migraines when they're in a cycle. So it's one of those things where anything we can do preventatively to hopefully make you feel as good as possible in a cycle, that's what we want.
Exactly. Well, let's do a couple short ones too. So moving away from the substances.
Yeah. This really should go without saying, but just to add, for all the wishy-washy data we have for alcohol and caffeine, we have such strong data about the negative for cigarette smoking. So, because I feel like sometimes we all know smoking is bad for us. I think sometimes people forget how bad it is for fertility. So when they look at meta-analysis for this, you find the pooled odds of pregnancy, live birth per cycle are about half for people that are smokers compared to never smokers. Odds of miscarriage also double. Odds of an ectopic are 15 times higher for smokers compared to non-smokers. So this is an area where We really do find basically every negative thing you could look at. You're going to have higher FSH levels, more frequent canceled cycles, lower number of retrieved eggs, lower implantation rates, even for donor egg recipients if they smoke. Like there's such clear data there. So that would definitely be any patients that we have that smoke, kind of like that's our top thing that we'd want you working on for lifestyle. And no one has like the hard part is we don't have great data on like best time to wait after quitting smoking, because you've got to take into account those age-related changes too. But quitting is always going to be so beneficial for your fertility as well as for your health.
Yeah, tobacco and nicotine in general, it's a firm rule. There's not a guideline about it. There's not anything wishy-washy about it. We definitely know that it's negative for both egg and sperm.
Yes.
And pregnancy. We'll save marijuana for another day because that's a whole topic in itself.
Yeah, that's its own thing.
Well, I'm sure we have the next one in common too. I'm sure people ask you about baths and hot tubs and saunas.
Yeah, definitely. What's your standard spiel? I bet we're similar, but
a lot of times people during IVF, their ovaries are uncomfortable, they might be crampy, or just any time really during treatment and pregnancy. I usually have pretty similar comments. So baths, fine. Unless you're post-surgery where there's an infection risk or something like that, you don't have to worry about taking a bath. A bath is great. It's relaxing. It's good for your muscles and it can decrease tension. The increased temperature from a bath does not increase your core body temperature. And that's what we're really concerned about. So things like hot tubs and saunas, they do increase your core body temperature, and that can impact your IVF cycle. It can impact sperm, and it's not a good thing to do in pregnancy.
Perfect. And I feel like you're right. I have the same talk all the time because I've had people, especially if the concern is the sperm count, is like, oh, I told him you can only take cold showers from now on. It's cold like, no.
Oh, no.
like we're not saying that heat in and of itself, it's that continued circulating high heat. That's the difference. Even if you get into a bath, like, woo, it's steamy. This is a hot bath. Like we know it's going to cool off. You won't sit in an uncomfortably burning hot bath. You'll kind of pick yourself up and maybe add a little more cold water. And then as it goes on, that's why it is different than a hot tub in that you're not raising that core. And that's what we care about in terms of potential damage with that high heat. And also it's a lot of exposure over time. So I've had people get super mad. They found out their partner forgot and went to the gym and soaked in a hot tub at that one time and they're having their retrieval. That's not something that we think is going to make a difference. It's really more that consistent use.
Yeah, that's a really good point too. Okay, I think that, so for baths, we have a pretty black and white there for us. And then I know I'm a bath person. I like baths. And I know some people are so grossed out by baths. They're like, you're just soaking in your own filth, which I understand is a little bit gross. But yeah, they feel so relaxing. I'm a vacation bath person. I usually don't take a bath unless I'm on vacation. And then I love when I have a hotel with a big bath.
And most of them don't anymore. It drives me nuts. Like the new hotel design is all like big fancy walk-in showers and no one has a tub anymore.
I know.
We're so old.
We are so old. Well, I think the other one that we can probably end with here is sex during an IVF cycle or an embryo transfer cycle. This might be individualized when it comes to the pregnancy side of things, so we'll talk about that. But for IVF cycle, and why do we tell people to abstain once they start their injections?
Yeah, I know it seems kind of backwards because especially when we have fertility patients that have tried to get pregnant, people are like, there's no way I'm going to get pregnant. But the whole point of our treatment is we're trying to control things. And so we really want to know, what is potentially going to be implanted in that uterus. And so especially if people have gone to all the work to do testing and we have a known euploid or normal embryo, if we have potential of either you're doing a frozen embryo transfer where you are going to also be ovulating an egg, or you're doing an IVF cycle where we're really trying to grow and stimulate a batch of eggs and we want to retrieve every possible egg, but there's still the chance that there could be like a late ovulation one a day or two after. Yeah. And if there's some sperm in your system, it is possible that someone could get spontaneously pregnant that same cycle. And for some people that might seem like, ooh, that would be great, but that's actually not ideal because we're really wanting the healthiest pregnancy, which would be a singleton pregnancy. We don't want there to be unexpected twins. And especially, we don't want there to potentially be an implantation of a spontaneous, potentially abnormal pregnancy when we're also putting a normal pregnancy into the uterus. So we really want the only potential pregnancy in a cycle to be the one that we are trying to help somebody achieve.
Exactly. And I actually have had that happen. I had a patient who was
doing, had it too.
Yeah, natural embryo transfer cycle. And the one that's coming to mind tried for, I think she had been our patient for like 8 years or something. Like it was a long time, and got pregnant with her embryo that was transferred, and got pregnant with the egg that she ovulated. And they ended up having twins that cycle. I remember her saying, she's like, seriously, this is the time that a sperm met an egg in my case. So it does happen.
It does. I had a patient too that was old school, a fresh IVF cycle where we only put in one embryo and then, oh, there's two. And, they originally thought it must be identical twins because we only put one embryo in. And then once they were born, they were clearly not identical. And they did testing like, oh yeah, they're, fraternal. And that's when it came out that they had also had intercourse like the either night of the retrieval or the next day. And despite very low sperm counts, like for whatever reason, that was the cycle. And obviously these are our exceptions in our 15 years of working here, but you don't want to put yourself in a situation where you then have a higher risk pregnancy than needed.
Absolutely. And sex also does put you at high risk for torsion because you do have that like jarring to the ovaries in some cases, at least with like penetrative sex. So that is another reason to avoid sex. Now, if you do have sperm in your reproductive tract, it can hang out there for several days. So, so even if intercourse happened at the beginning of your injections and you trigger several days later, it's potential that there is probably still sperm present in the fallopian way hanging around. So if you happen to release some eggs that we don't retrieve on egg retrieval, it's very possible.
And that is important to mention, too, that is our main concern with wanting abstinence. So I've had people say, well, is it okay if I have an orgasm? Can I use a vibrator? Is an orgasm going to cause something bad in terms of my chances? No, we're not worried about that. Our restriction is purely to avoid unintended pregnancy in that situation. And as you mentioned, not wanting to put a whole lot of strain or pressure on the ovaries. And so if people decide that they are going to have intercourse despite our advice, then using a barrier method like a condom is still better than nothing at all, so that we're hopefully minimizing the chance of there being sperm in the reproductive tract.
And we realize that this is very ironic, having this conversation for patients that are going through infertility treatment. But we obviously aren't going to answer all the questions that we've heard here today, and we can definitely do another one of these in the future. So if you do have questions, send them to us either through Instagram at The Whole Pineapple Pod or email thewholepineapple@gmail.com, and we would love to do these in the future if it's helpful.
Yeah, especially because I know there is a lot of clinic to clinic variability. Like when I go to conferences, sometimes I'll see other people's instructions. It's like, oh, wait, you tell them to do what? Really? Well, why do you do that? So I do think it's interesting to hear what people are being told to avoid and why. Because the thing is, just like my restaurant instructions, it's so frustrating that really like there's not a whole lot of stuff, right? Like we're avoiding these few things that we know, but there's not the magic other corollary. There's not some like mystery food you're supposed to be eating or some magic supplement, or there are a lot of people peddling a lot of do's that don't have evidence behind them. And so that's why we talk so much about just overall health and lifestyle and nutrition and kind of the stuff that you're doing for yourself or should be doing every day to keep yourself healthy. That's really the most important stuff when you're also thinking about fertility treatment.
All right, we will see you next time.
Thanks for listening. Thanks for joining us for this week's episode of the Whole Pineapple Podcast. We hope it was helpful.
If you know someone who could benefit from hearing the podcast, we hope you'll share it with them.
And don't forget to subscribe, rate, and review the Whole Pineapple on your favorite podcast app. Every rating and review makes us easier to find.
This podcast is sponsored by Seattle Reproductive Medicine and is produced by Audiotocracy Podcast Production. We'll see you next time. Have a delicious week.